The modified pen grasp demonstrated is for use with both scalers and curettes. The routine use of air is required to dry the tooth surface. The anterior sickle scaler has 4 blades in total, 2 each side. It is a double-ended instrument used for supragingival scaling. The fourth finger is used to establish a finger rest or fulcrum. The finger rest must be positioned to enable the use of the wrist forearm motion. It should be close enough to the working end to allow you to keep the fourth and little fingers together in a built-up fulcrum. The location of the finger rest must be frequently adjusted or repositioned. The working end is in contact with the tooth, the first 1 to 3 mm of the pointed toe adapted supragingivally on the tooth surface. Gauze is used to wipe the instrument clean of debris. The sickle scaler is placed interdentally between the teeth to remove supragingival plaque and calculus. There may be a little bit of bleeding during this process, but this is of no major concern. The instrument is then moved around to remove plaque and calculus from the buccal surface of the teeth. During this procedure, adequate finger rests and fulcrum must be maintained for stability of the cleaning process. When scaling and cleaning, one should do it in a sequential manner, beginning with the mesial surfaces of a group of teeth. Having done that, we then do the buccal surfaces of those teeth, followed by the distal, and then move to the lingual. The McCall scaler, often known as the universal scaler, is used on posterior teeth. In some circumstances, the McCall scaler may be suitable for adaptation on the anterior teeth. The McCall scaler is placed on the distal of the upper left first molar, as in this case, and then moved around to do the distal part of the buccal surface. The instrument is then turned around so that we complete the scaling on the buccal surface and then move on to the mesial. Again, the first 1 to 3 mm of the working end is adapted. The working cutting edge, as with the sickle scaler, is placed at 90 degrees to the tooth surface. Before any scaling, a full periodontal examination is required. Prior to subgingival scaling, reassessment of probing depth is required to familiarise yourself with the anatomy of the root surface and the extent and location of any subgingival calculus. The Gracie curette is designed for subgingival scaling, or as often as known, subgingival debridement. Gracie curettes are double-ended, with one functional cutting edge on each end. The instruments are area-specific. For example, the 1-2 is used on all surfaces of the anterior teeth, the 11-12 the mesial surfaces of posterior teeth, and the 13-14 the distal surfaces of all posterior teeth. When a Gracie curette is adapted to the tooth, The lower shank should be parallel to the tooth surface. The angle between the face of the blade and the tooth is about 70 degrees. This angle will enable effective calculus removal with pull motion strokes. Vertical and oblique pull strokes are predominantly used. In some circumstances, a horizontal stroke may also be suitable. The instrument should be used with firm pressure on the pull stroke, then gently reinserted back into the base of the pocket. In this example, we are using a Gracie 1-2 on the maxillary anterior teeth. Note that the curette is not removed from the pocket, but moved gently up and down 2 or 3 millimeters in the pocket, and only removed when cleaning of the curette is needed. When the blade is inserted subgingivally, the cutting edge is adapted against the tooth so that only the convex back and the curved lateral surfaces are in contact with the soft tissues. This minimises the chance of laceration or discomfort to the patient. It also allows the working edge of the instrument to fully reach the base of the pocket with minimal tissue distension. This demonstrates the use of the Gracie 11-12 on mesial surfaces. When using Gracie curettes subgingivally, one may get quite a lot of bleeding, but this does not mean that we have damaged the tissues. The bleeding is purely due to the inflammation of the tissues and should be of no major concern if you are using the correct technique. This demonstrates the use of the Gracie 13-14, mainly for distals of posterior teeth. The 11-12 and the 13-14 can also be used on buccal and lingual surfaces using the same adaptation principles, keeping the lower shank parallel to the long axis of the tooth and the lower third of the blade in contact with the tooth surface. This demonstrates close adaptation of the Gracie 13-14 to the distal surface of the first molar. Further information on these topics can be found in your periodontology student workbook.